Okay, let's dive in. We're looking at something really timely today.
Yeah.
How technology, specifically AI and health data, is helping us fight outbreaks and, maybe even predict diseases. Feels pretty relevant after the last few years.
Absolutely. Yeah, the sources you shared for this deep dive, they focus right on that intersection. How electronic health records, EHRs, and AI are becoming, well, essential tools in this area.
Right. So our goal here is to kind of cut through the complexity and give you the key takeaways from the sources. How are these digital tools actually being used on the ground against infectious diseases?
Yeah, good question.
Let's start with the basics. What are the main pieces here? How do EHRs and AI actually work together in this context?
Okay, so at its core, it really boils down to data. The sources are clear. Electronic health records are the starting point.
The raw material.
Exactly. But it's often combined with other data streams too. Then you have artificial intelligence systems stepping in to analyze these huge data sets, basically in real time.
So it's like superpowered data mining.
You could say that, yeah. Large-scale data mining, constantly looking through patient info for signals.
And I guess it's not just about tracking diseases we already know about. There's this term syndromic surveillance. What's that about?
Ah, yes. Syndromic surveillance. It's fascinating, really. Think of it as an early warning system.
Okay.
It tries to spot unusual clusters of symptoms or maybe common exposures among groups of patients before anyone's even officially diagnosed.
Before diagnosis. How?
Well, the sources mention looking at patterns in data from places like ambulatory electronic health records, so records from clinics, outpatient visits, that kind of thing.
So you're scanning like general health data from the population, looking for maybe a sudden spike in fevers or coughs in one area, things that might signal something bigger starting.
Exactly that. It's like looking for the subtle ripple on the water before the big wave hits. And, the sources point out this is especially important in regions that are considered potential pandemic hotspots. Early detection there is absolutely critical.
Right, makes sense.
Now, this is where AI gives us a real edge. Traditional methods, they really struggled processing that amount of messy, real-world data fast enough to be truly proactive. Very difficult.
Ah, okay. So the AI isn't just faster. It actually allows for a different kind of detection altogether. Is that the insight?
That's a great way to put it, yes. AI algorithms can dig through these massive complex data sets and find connections, subtle patterns that, frankly, a human analyst or simpler software would likely miss.
Patterns like what?
Patterns and symptoms showing up together, or across linked locations, maybe specific demographics, even connections between patient visits that aren't immediately obvious. It just means we can potentially spot the beginnings of an outbreak much, much earlier.
That sounds like a genuine game changer for early warning.
It really could be. Yeah, it fundamentally shifts what kinds of signals we can even perceive and how fast we can act on them.
Okay, wow. So that's detection covered.
Yeah.
But the sources also mentioned forecasting, right?
Yeah,
Looking ahead. How does AI help predict where an outbreak might go?
Yes, forecasting is definitely another huge application area. The sources talk quite a bit about AI-powered systems for pandemic resource planning and modeling.
Modeling the spread.
Essentially, yes. These systems simulate how an infectious disease might move through a population.
And what do they factor into those simulations?
Oh, things like population density, obviously, but also mobility patterns, how people move around, vaccination rates, basic demographics. So they try to mimic the real-world transmission dynamics.
And the point is to predict.
Resource needs. Crucially, resource needs.
Like how many hospital beds we might need.
Exactly like that. Or ICU beds, ventilators, even specific things like oxygen supply or medications.
And that info goes to
Public health officials, hospital administrators, people who need to plan strategically. Knowing the potential demand helps them allocate resources effectively, shift supplies, prepare staff, hopefully avoid being completely overwhelmed. It supports data-driven decisions.
It sounds incredibly useful for managing a crisis as it unfolds. Do the sources give any, real-world examples where this actually made a difference?
They do. There's quite a compelling anecdote from India. During the second wave of COVID-19, apparently a national task force there used one of these AI-powered pandemic modeling systems.
And what happened? Did it work?
Well, according to the source material, yes. The system provided pretty accurate forecasts of how the virus was spreading.
And that helped how?
It allowed the government to mobilize resources more proactively. The source specifically highlights how these predictions helped anticipate and prevent widespread shortages of critical things like medical oxygen Big
Yeah.
deal at the time.
Wow. Yeah, I remember those reports. So that's a really concrete example of this technology potentially saving lives and easing pressure on the system.
It really underscores the potential impact, doesn't it? And, the benefits aren't just limited to these acute outbreak situations.
What else?
Well, AI and health data also contribute to broader public health surveillance, just giving us a better, deeper understanding of community health trends over the long term.
Okay.
The sources also bring up something called AI-powered population health risk stratification systems.
Risk stratification. What's the idea there?
The goal is to analyze large population data sets to identify which individuals or which groups are at higher risk for certain health problems, or who might benefit most from specific targeted interventions.
The preventative screenings or specific health campaigns.
Exactly. The insight here is really about efficiency, but also equity. If you can identify those most in need, you can target limited public health resources more effectively, get the biggest bang for your buck, so to speak, and hopefully address health disparities.
So it's about optimizing where you put your effort and money for the best community-wide outcomes.
Precisely. It raises that important question about how we best use limited resources for the maximum health benefit across the whole population.
Okay, so let me try and synthesize this. We've gone from using AI and data for like super early outbreak detection.
The syndromic surveillance.
Right, to forecasting the spread and predicting resource needs like beds and oxygen.
Some modeling systems.
To even identifying at-risk groups for targeted public health efforts long-term.
Yeah, the risk stratification.
It really covers a lot of ground, moving us from just reacting to actually maybe anticipating and planning more strategically.
That's a great summary. It provides the tools for, let's call it proactive orchestration rather than just reactive responses. And the sources also mention related benefits, potentially speeding up things like vaccination campaigns, maybe reducing costs, lowering workload, those kinds of operational pluses too.
It definitely paints a powerful picture of what happens when you combine digital health records and smart AI. This transformative potential for building, well, a healthier future.
It does show immense promise for anticipating and responding better to outbreaks, though it's worth noting the sources also acknowledge, significant hurdles remain.
Right, it's not magic. There are always challenges with implementation, data privacy, all that.
Exactly. Integrating these systems effectively and equitably across different health systems globally is still a major task.
Absolutely. Which leads to maybe a final thought for you, the listener. Given all this incredible power we've talked about, using data to spot hidden threats, predict needs, guide actions, what do you think is the single biggest challenge we still need to overcome to really harness all this potential of AI and health data for everyone's benefit? Something to chew on.